So we're going to
Okay.
have two guests this evening. We have Francine Smith Perkins, who is one of our Wakanapreneurs. She has been on our medical advisory board. She is a registered nurse. She's done a lot of work in diabetes and a lot of health disparity and prevention. Tonight, her and her cousin, Dr. Bettye Smith, are going to present some information about breast cancer screening and some of our products and its usage. So take it away, Francine Perkins.
Thank you, Dr. Beat. And again, I apologize, everyone, for the delay and the technical difficulties. It's on me. My bad, as they say. So my title is Sisters, Dense Breast Screening and Cancer. So we know a lot, we talk a lot and hear about breast cancer all the time, especially during the month of October, but sometimes it's we miss some of the specifics. So I want to talk about some statistics and other things that we should be aware of. And it's not designed to frighten anyone or discourage anyone, but to empower. So we'll know that we can take our own health into our hands and advocate for ourselves. So the next slide, this slide shows, first of all, I'm going to give you a brief overview of breast cancer. Breast cancer, we know, occurs when cells in the breast tissues mutate or change and grow out of control, creating a tumor or a mass of tissue. Like other cancers, it can invade and grow into tissue surrounding. That's called metastasis, and it can travel to other parts of the body and form other tumors. Okay, so these slides show the incidence or the rate of, this is an older slide, but the rate of women who are impacted or diagnosed with breast cancer between the period of 2014 and 2018. And here we see that white women and Black women are kind of close, right, in terms of diagnosis and acquiring the disease. But when you, let's see, get over here. When you go over to this chart, the mortality rate in the United States, it's a different story. White women, I mean, the rate of women who die from breast cancer is much lower than Black women, and lower than, Asian Pacifics, Hispanics, and Indians are also lower than Black women. Okay, so the mortality rates we know differ from for women of color. Cancer deaths in the United States decreased significantly, 27% from 2001 to 2020, but that's not the case for Black women. Black women are 40% more likely to die from breast cancer. And Black women have twice the likelihood of developing triple negative breast cancer. So it's thought that there are a lot of factors that contribute to these rates. That includes what we know is systemic racism, late diagnosis and identification by us, Black women reporting that there are problems and seeking help, but also provider bias, sometimes not getting the correct diagnosis or not being taken seriously by providers or people doing the testing. So these things are, there's a racial wealth gap. The poorer you are, the less likely you are to seek help. It isn't necessarily available or accessible. If you have financial issues, you may not have money to go to the doctor for public transportation or even for child care. So lack of access, and insurance is usually poor for poor women. And as I've mentioned, there's a bias in healthcare. And we are subjected to more aggressive forms of cancer, like triple negative. Okay, so this slide shows different types of breast cancer. The slide on the left shows that this is the early cancer. Nothing has invaded the cells, so it's not an invasive. This is referred to as ductus in situ cancer. But when it enters the lobes, you see different things going on. This is invasive cancer. But there are two types of invasive breast cancer that disproportionately impact Black women. and they are triple negative cancer and inflammatory breast cancer, or IBC. Okay, this is a slide of a breast with inflammatory breast cancer. What you frequently see is pitting of the skin. It looks like an orange. The skin is reddened and it's a rash. The breasts are enlarged. They may feel heavier in one breast than the other. It may be larger, it may be warm to touch. The nipple may be inverted. But this is a difficult one to diagnose because it may be confused with another disease or illness like eczema or some other thing. And doctors may not readily decide to do diagnostic tests for cancer. So inflammatory breast cancer is rare and highly aggressive. Okay, it accounts for 1 to 5% of all breast cancers, but Black women are 70% more likely to have this disease. Statistics show that the 5-year survival rate for Black women is lower than it is for white women, regardless of the cancer's hormone receptor status and the patient's age. So a lot of cancers are identified by their hormone receptor sites. And okay, the next slide shows a triple negative breast. This is this is a receptor, and this is the triple negative breast cancer, but the receptors aren't there. The receptor sites for the hormones like progesterone and estrogen are not there. So it minimizes the ability to treat them effectively with medicines that respond a lot to these medications. Triple negative breast cancer is aggressive, as I've said, and it's more prevalent in Black women under the age of 40, or those who have a BRCA1 mutation or BRCA1 mutation. And these are simply BRCA1 and BRCA2 are genes that suppress tumors and keep breast cells from growing and dividing too quickly and uncontrollably. So triple negative cancers lack the hormone receptor sites for estrogen, progesterone, and a protein called human epidermal growth factor. You may hear that referred to as HER2. So if hormone receptors are present, then the cancer can be treated with hormone modulating medications. If those receptors are not present, cancer is much more difficult to treat. And that's what happens with triple negative. 15% of all breast cancers are triple negative, and that number is, again, pretty dismal for Black women because it's so aggressive, and the mortality rate is kind of not where we'd like it to be. Okay, and so breast density may play a factor in triple negative breast cancer. So there are 4 categories of breast density. The latter 2, C and D on this slide, are considered dense breasts with over 50% density. So dense breasts are common and normal. In fact, 43% of women ages 40 and older have dense breasts. But it's also associated with breast cancer risk and is higher in Black women than in white women. And so dense breasts are the #1 reason for cancer being missed by mammograms, since both cancer and dense tissue show up white on a mammogram. You see the little white stripes here. These are dense tissues, and a cancer show up the same way. So mammograms miss about 50% of cancers in the highest category, D, the extremely dense breast. Okay, so what I have here are copies of mammogram test results. When you go and have a mammogram, you are usually given a report or sent to your doctor, but we also have the ability to gain access to our own reports through your company or your doctor's portal, your hospital's portal, like My Chart or whatever they call it. In my case, it's North Shore Connect, but it's a way to get access to your medical records. And this is something that we really should start doing if we're not doing it. So this is a example of a mammogram, a regular mammogram. Okay, it says the breast tissue is heterogeneously dense, and this may lower the sensitivity of mammography. No masses, calcification, or other abnormalities are seen. No significant interval changes when compared to prior studies. So this is what your doctor, the radiologist, is looking at who interprets your mammogram results. On the right side, it's the same thing. It shows that breasts exhibit heterogeneously dense fibroglandular parenchyma, which may obscure the detection of small breast masses. So in other words, they have the mammogram results, but if your breasts are dense, like in these two slides, then there may be a cancer that they are not identifying and they cannot see because it's hidden. So they are obligated now, there are laws passed that providers have to tell you that your breasts are dense, you know, and that the cancer may not be visible, but many times we don't follow up on that and we just take it, you know, as what's there. But it behooves us to really get educated and speak with our providers and ask questions. Well, what does it mean? What can we do next since you can't see it, you know, a tumor, something may be obscure or hiding because of my dense tissue. Okay, so there are tests that show that can find the tumor in spite of dense breast tissue. And these may be 3D tomosynthesis. Those are kind of 3D mammography tests. And nearly half of U.S. women who undergo screening have dense breast tissue, which reduces the screening's ability to detect cancer, which is associated with moderately higher risk for developing cancer. But new research by physician scientists at the University of Washington suggested adding tomosynthesis or 3D mammography to routine biannual mammogram screening among women with dense breasts could improve health outcomes at a reasonable cost relative to digital mammography screening alone. So the thing is, because of sometimes provider bias, they sometimes don't think that women will follow through, or we don't ask questions. They don't order these more detailed tests. They may do a mammogram, and like in this lab report, they tell you to come back in a year for routine screening. But by that time, the cancer may have grown. So it's up to us to ask questions and ask for more thorough testing. And if you don't get the results that you want from your provider, who is handling your health, then find another one, I would suggest. So we have to advocate for ourselves. Okay, so interpreting mammograms, this talks about how radiologists look and interpret your mammogram results. It's called a BI-RAD score, and you may want to look this up yourself because this is also listed on the mammogram report. The scores range from 0 to 5. 0 means more information is needed. It may need another mammogram before a score can be given. 1 is nothing is abnormal. 2, benign conditions such as cysts are seen and routine screening should be continued. 3, something is seen that probably is not cancer and must repeat a mammogram sooner than biannual. Biannual means every other year, but they may recommend that you come in within 6 months. 4, something is seen that is suspicious for cancer and may need to have a biopsy. 5, something is seen that is highly suggestive of cancer. So this is what the radiologist sees. But again, you know, we don't always get that information. So a study published in a journal shows that even though digital breast tomosynthesis, DBT, is the better mammogram for breast cancer screening and has become a standard of care in the U.S., significant racial disparities in who receives the superior technology exists. Again, it depends on your community. If you're going to a community hospital, they may not have that technology at that particular hospital. But again, you have, it is your right to ask to go somewhere else. If there's anything suspicious, you can demand additional testing. Again, okay. Okay, so screening technologies that we're familiar with. The first one is a mammogram, and most of us are familiar with that. The breast is inserted into these two pads, and they are squeezed, to get the radiographic photo. Now, we know that this is painful, uncomfortable, and that's been a reason why some women have said, oh, I'm not going to have a mammogram, it hurts. But having cancer will be more painful than having a mammogram. Some of the advanced technologies are to the right. This is like an ABIS machine, which is an automated breast ultrasound. And it's painless, radiation-free procedure that uses sound waves to create a 3D image of the breast. It is used in addition to a standard screening mammogram to increase the accuracy of breast cancer detection in women with dense breast tissue. Okay, that means it doesn't have a lot of fat. It has more fibrous tissue. Okay, and it's really not a painful thing. This little device is pressed over your breast. Is not pressed, but goes over your breast, and the images are taken. And it's more accurate measure. And again, all facilities do not have the ABIS, but many of them have other technologies which have emerged and produced 3D images of the breast. Okay, so we're familiar with, we talked about the regular mammogram and the ABIS, but there's also a 3D digital screening mammogram. It uses the tomosynthesis technology to produce multiple three-dimensional views of the breast for earlier, less painful, and more accurate detection when symptoms aren't present. And then there's an MRI that we're familiar with for other extremities, but it uses radio waves and a magnetic field to create detailed pictures inside the breast of patients who have already been diagnosed with breast cancer or who are at risk for breast cancer. Breast MRIs are also used to further evaluate an abnormality suspected on a routine screening mammogram. And it can also measure the size of the cancer, look for other tumors in the breast, and check for tumors in the opposite breast. It shows different angles and creates pictures of soft tissue in the body that is difficult to see with other imaging tests. And the traditional ultrasound is a complement to other screening tests. It cannot be used to determine whether a lump is cancerous or not. So what happens, the regular mammogram is usually used in conjunction with one of these other technologies. You may have a mammogram as well as an ultrasound, but you may have to ask for that, rather than saying, well, we see something that, we can't see it, come back in a year. You can say, well, what can we do to ensure that there is nothing there since you can't see it? Okay, so men and breast cancer. Men represent about 1% of breast cancer cases, and they are often misdiagnosed. Their disease tends to be more advanced when detected compared to women, and that's because many men don't even know that they're capable of developing a breast cancer. Let's see, it becomes often because it never occurs to them or their doctors that cancer may be a possibility. So by the time they seek help for their symptoms, their malignancies are usually more advanced and more lethal. So men need to examine their bodies just like women examine ours, examine our breasts. Men need to look for any changes, any drainage, any swelling. So these are some of the early signs of breast cancer. You look for a lump. Most lumps, are found by self-examination. Just checking your breast monthly. You may see a pulled in nipple, inverted nipple. You may see dimples like with the other malignant cancer with the orange dimpling in it. You may see dripping, some kind of drainage from the breast, redness or rash, or any skin changes. So the same thing applies to men. So knowledge for all of us is power. And we know that we don't necessarily get these advanced technologies and testing without asking. So it's up to us to empower ourselves, to empower our daughters, our sons, and our other friends and relatives about things that they can do. So I am done, and I want you to stay healthy and vigilant with your screening and testing, and I would like to turn it over to Dr. Rita, and I think Dr. Bettye will follow with saving the girls and the boys. Thank you
Thank
much.
you so much, Francine. Thank you so much. Great information. Can you just touch on self-breast exams? Because I
Okay, I think
know.
we will cover it. I think she has a chart that shows you how
Okay.
to actually self-breast exam.
Okay. Well, then
No, go ahead.
then I'll hand it over to Dr. Bettye.
Okay.
Okay.
Hold on one moment. Here am I with my techie self.
So I'm going to bring up Dr. Bettye, who's a Ruby in our company. She is also one of our medical advisory board members. She's a registered nurse and a naturopath. Does a lot of work with energy and essential oils, and of course, one of our Wakanapreneurs. So I'm going to bring her up now. Dr. Bettye, you can take it away.
Okay. Can you guys hear me?
Yes, we can.
Okay. Hold on one moment. Let me get my technical stuff together. I was trying to have it together before I got here, but hold on.
Dr. Bettye, are you okay? Are you able to share your slides, Dr. Bettye? You're on mute.
Yes, some of them. Hold on one minute. I'm just pulling the rest of them up there so that I don't have to be delayed any further. What I have here and let her rip so that I don't hold you out any further.
That would be great. Thank you.
No, right? All right, so can I share my
Try to
screen?
share your screen. Yes, you should be able to.
No, I mean, I don't want to. That is not working.
Did you want to email it to me so I can control your slides?
I don't even know where to find it. Hold on.
Or what you could do,
Oops, that is not
you
a
could just, if you can't pull them up and you can't email me.
How about if I just talk?
Right.
Let's just talk about it. All right, so let's just get to it here. Okay, so thanks for your patience, everybody. So my part is about protecting and saving the girls and the boys. And there's a cute little image of the pink ribbon for women's breast health and the blue ribbon for men's breast health. And like Fran said, look, we've all got boobs. And so because we do have breasts, whether we're male or female, yes, we can develop things like cancer. So I got to fight with my cat. So the first topic or the first subtopic is breast health for all. So my question is, hey, what's in it for me? So listen, we've got diet, we've got the importance of eating a clean diet. And a clean diet is one that is diverse in its contents, that is hopefully free of pesticides, herbicides, as well as chemicals that are used to preserve foods. So we're talking about avoiding things like processed meat, which is laden full of things like sodium nitrate, which has been proven to be carcinogenic. Things like other chemicals like monosodium glutamate and other chemicals that are used to color food, to preserve it, to decrease spoilage and that kind of thing. Our bodies don't know what to do with those things. So we want to scratch those things out in terms of, you know, eating a clean diet. And then the other thing is your diet is really to nourish the body, to provide raw materials to the body so that it can heal, regulate, and regenerate itself. But if we don't provide clean and nutrient dense substances to the body cannot function as it is as it is meant to. So at this point, I want to kind of bring in our flat belly lifestyle. This is a 21-day raw cleanse that is designed to cleanse the body of all the reported 9 undigested meals that we have at any given point in time, to cleanse that out, to pull the toxins out of the intestines, at the same time eliminating parasites, eliminating mucus that is inhibiting the absorption of nutrients into the colon for distribution throughout the body into all the cells so that they can be rejuvenated, and so that there is raw, healthy material and nutritious material to build new cells, new healthy cells on. So that's what's in it for me and thee in terms of the diet. Now, another aspect of eating is through the skin. Did you know that everything that you put on your skin goes into your body, into your bloodstream, and is distributed throughout? So we want to have products that are free of toxic substances like sulfates, like parabens, what is that? Propylene glycol and the like, because those things, the body has no idea what to do with them. And so those become the toxins that are stored in the fat cells of our body and distributed, throughout our body. So then the other question becomes, well, how do we maintain this breast health? Well, like I said, through diet, and then through self-breast examination. And I definitely want to find that slide so I can show that. I know that I have that nearby. Ah, here it is. And I'm going to share my screen for that for sure. I think I can do that. Because this is a really good one, and it really behooves every man as well as woman to really take the time to learn how to and to do on a monthly basis, hopefully around the same time each month, but to really do self-breast examination. And sometimes women especially say, oh, you know, my breasts are fine. I don't necessarily want to be feeling around there. But the more you know about how your own breasts feel, the more assured you can be that you will be one of the first, if not the first, to recognize that there is something unusual in the feel, the look, etc. of your breast, and therefore you can take action early on to prevent complications and to catch anything that might be awry, catch it early. Okay. Did everybody see? Was everybody able to see that? Hello? Hello? Was everybody able to see that screen?
I can hear you. Oh, you're muted now.
Was everybody able to see that self-breast exam screen? Okay, good. Okay, so now, so self-breast exam is a must for everybody, all women and all men, so that you know what your breasts feel like on a normal, and regular basis, and so you can detect when there's something awry. So my next question is, to sweat or not to sweat? Now, sweating or perspiring, if you want to be a little more technical, it's a natural cooling system for the body. That is how, especially when we are stressed, when we're overheated, that is how the body actually cools itself down through sweat or perspiration. So we've got lots of pores in our armpits. We have also lots of lymph nodes. We've got and lymph glands. And so the purpose of sweating, number one, like I said, is to kind of cool you down And this is a natural process. And so with that coolant comes a bit of moisture that we might experience under the arms. And most people really don't want to see that. And that is where I believe we have had the development of antiperspirants. Well, the only thing about antiperspirants, or one of the things I should say, is that there are aluminum products or substances that are utilized to make up antiperspirants. And antiperspirant means stop me from sweating, okay? And so just think about it. Now that is a natural system, and the pores are there to eliminate toxins, to cool you down, to let the steam off, actually. And so we don't want to sweat. We don't want to see that ring. So we say, stop it. And we put on an antiperspirant. And you know what? That clogs your pores. And not only that, remember I said, whatever you put on your skin goes in your skin and you are feeding it to your body. So guess what? When we use those kinds of antiperspirants, especially with aluminum in them, we are literally stopping up the pores, number one. And then number two, we're sending those substances into our system to be absorbed and circulated throughout our body. Now, there's some controversy about whether or not these aluminum substances actually travel to the brain, whether they're crossing the blood-brain barrier and being deposited in the brain, stimulating the possible, and I say possible, the development of Alzheimer's disease. I don't think anybody out there wants that, do they? So, so I would venture to say that, you know, this kind of behavior is really working against nature. Mother Nature, you know, our bodies are developed, a magnificent machine, and just about everything has been thought of. And that natural cooling system is to be respected and not shut off. Because if you recall, I said that also toxins are eliminated through that, that perspiration. So, you know, we're just fighting against our own body when we do those kinds of things. So the other thing I know people are concerned about, not only just the little moist ring, is a stinky pit. You know, when somebody raises their arm, it's like, whoo, you know, one of those kind of things, or sometimes they don't even have to raise their arm. But did you know that not only does our body eliminate toxins from the armpits, but when that moisture, that sweat, that perspiration hangs around for a bit, it can be quite funky. And that is only because bacteria is developing there. And so that's where we get the stinky smell from. So, so like I also mentioned, we have our lymph nodes and lymph glands and that kind of thing. And their job is to take those toxins that are circulating there and to assist them out of the body. So if we inhibit that sweat, then that perspiration, those toxins just keep recirculating in our body. Now, in order to assist the toxins to be removed from the body by way of the lymphatic system, we need to move. And when I say move, we need to move our arms, because we're talking the lymph nodes and glands under our arms. And if we're sitting like this all day long, working on the computer, writing, and that kind of thing, and we're not moving, then guess what? That waste, those toxins, that lymph is not moving either. So let's get moving, get those arms moving, get them circulating so that that lymph, that waste is pumped out along with the muscle contract by way of the muscle contractions. This is the only way that it moves out, is by way of muscle contraction. Okay, so let me see. So that was okay. So now we talked about those bits of self-care. Oh, so I wanted to give you some information about some natural deodorants, and there are a plethora of them on the market. I have tried many of them. Some of them work, and some of them don't work too well. So, but a couple that I have tried that work very well are things like the Crystal Rock. Although now, see there, you have to be careful because it's dependent on where that mineral crystal has come from. If it's come from a toxic source, then, and you put that under your arms, then guess what? You could be causing more problems than not. Then there are some others who have some very beneficial ingredients in them. Some like Tom's deodorant, Schmidt's deodorant, and guess what? Wakana is in the process of formulating an all-natural deodorant. So you can look to the time of the end of the month when we actually it's on 7/23, that we will have our Freedom Conference, and it will be unveiled at that time. So I have had the pleasure of trying it, and it's still being tweaked, but I'm telling you, it is the bomb diggity. So plug in for Wakana. Anyway, then the one other thing that I wanted to just go over with you was and I might be able to share this. Hold on. So there's a woman, her name is Louise Hay, and she has oh my gosh, I mean, I've known about this woman and have pretty much followed her for years and years and years, and in fact, decades, I must say. She has researched and recorded the mental causes for physical illnesses and the metaphysical ways that you can utilize to overcome them. She does this by way of affirmations, really positive affirmations that relate to specific body parts. And hold on, I'm trying to pull this up here. No. Hold on. Okay. Okay, here is her. Fiddlesticks. Okay. Come on, come on. Okay, this is her information here. Can you guys see that?
Yes,
Can
we can.
you heal your body?
Yes, we can.
Okay, awesome. You might want to take a screenshot of that so that you can check it out later, because I'm telling you, she is phenomenal, and she will give you some information that that you may not have thought of in terms of a body part or a system or an organ or some ache, pain, etc., that you're having, and how it relates to your mental status. So it's an excellent tool to get more in touch with yourself. Okay. And so then I want to just show you her interpretation and her explanation about breasts. And I had this out, but I have no idea where it is right this minute. So I'm just going to pull this up for you guys so you can see it quickly. It's very, very interesting. The breasts are about nourishment. Okay. Let's see. That's not going to do that. Okay, I'm going to share my screen here. Hopefully you can see this. Can you guys see that? You see breast?
Yes, we can.
Breast problems? Awesome. Okay, so you can see that the breasts represent mothering, nurturing, and nourishment. And her affirmation to assist with issues about the breasts are, I take in and give out nourishment in perfect balance. Because some of us, especially some of us in the healthcare industry, we know how to give it out. We can nourish and nourish and nourish and give and give and give, but we have a very difficult time accepting or taking that same kind of nurturing nourishment for ourselves. So this is a good one for people who have that issue. And then in terms of breast problems, she categorizes it as a refusal to nourish the self, putting everyone else first. Does that sound like anybody you know? So and then over mothering, being overprotective, overbearing attitudes, all of these things relate to the breast. Her affirmation for that to assist you to move back to balance is, I am important. I count. I now care for and nourish myself with love and with joy. I allow others the freedom to be who they are. We are all safe and free. Isn't that amazing? Okay, let me find you guys. Wasn't that amazing? Who think that such, I don't know such wisdom is housed in organs of the body, and how we we kind of disregard ourselves, and we have no idea what we're really doing when we do those kinds of things. So that is another way to nourish. And then one of the very last things that I want to talk about, since we've already gone over, is EMFs. And so the EMF stands for electromagnetic frequencies. And so we're talking X-rays, we're talking antennas, we're talking the transformers that you see everywhere. We're talking about 5G, we're talking about cell phones, we're talking about tablets, computers, microwaves, radios. We're just inundated with all of these kinds of things. And did I mention 5G? Oh my gosh, it's coming. It's some places, but it's coming en masse. And so we need to protect ourselves. We need to get ready for this onslaught, this larger onslaught, because that's exactly what it is. We got smart meters they put on the outside of people's homes without permission. And now we are we're the victims, really, because that radiation from those smart meters comes smack dab into your house. my sister's, she's got a ranch, house home, and her smart meter is right outside her kitchen window. And my sister's very sensitive, and when she stands at that side of her kitchen, she can feel, I'll just say it's energy that she can feel. But she's always saying, don't stand over there, don't stand over. She tells her kids, don't stand over there. And so, things that you can do to kind of get a handle on and detect the amount of radiation or EMFs that you're exposed to. You can buy an EMF meter. You can even You can even download one on your phone and check out things like your computer, these various devices that you have in your house. You can also purchase certain apparatus that will kind of block those EMF frequencies and minimize the damaging effect that they actually have on your body. And trust me, they do have a negative effect on your body. And don't let anybody tell you any different, because if you if you notice, when you get your new cell phones, they don't even give you a manual anymore. And you'll also notice that nobody really talks seriously about the radiation or the electromagnetic frequencies that are emitted by cell phones. Ladies, do not, I repeat, do not put your cell phone in your bra. Do not put it in a pocket by your breast. And brothers, don't you do it either, because guess what? That is an electromagnetic device, and your heart is an electrical device. So it can be disruptive in one form or fashion, and it can be very, very, very subtle, very occult, and you'll be none the wiser. Ladies, please don't put the cell phone in your bra. That is not a pocket, okay? No, I can't say that. Okay, so I do know of women who used to carry their phones in their bra. And I know a couple who actually developed breast cancer, and it was right there where their phone was. And there are other examples of such negative effects. So please, just don't do it, okay? Put it somewhere else. Keep it away from your jewels, guys. If you want to have kids, keep it away. And so then, just to give you a couple of things that you can use to help with minimizing those negative effects, you can use crystals, quartz crystals, the black tourmaline. There's one called Cybin. There's shungite. You can get these from any crystal store. You can even get crystals online for your protection. I have a couple of shungite crystals, and I put them where my TVs are, where my computer is. I have one that I keep in my purse because I always have my cell phone with me. They become appendages. So, think about and investigate the things that you can do to protect yourself from these electromagnetic frequencies. There are even diodes that you can put in your home, on your electrical outlets or on your surge protector, and they really do diminish the electromagnetic frequencies. And then one other thing that I want to tell you about real quick is there is a fabric It is called Faraday Fabric, Faraday. You can purchase it by the yard. You can purchase actual clothing items. You can purchase like bags of envelopes and that kind of thing that you can actually put your devices in, your tablet. You can slip your cell phone in one. They have underwear, they have skull caps, they have numerous clothing items that are made from this Faraday fabric, which will act as a shield between you and the electromagnetic frequencies and the negative effects that they have on the body. So I am going to close. Oh, and then you can also buy these copper cages that you can put around your smart meter, and it limits and or eliminates the electromagnetic radiation that literally comes through the walls. Okay, so that is it for me. I hope that I covered everything, and I hope you guys got something out of this. Thank you so much for your long attention. We love you.
Thank you so much, Dr. Bettye. Thank you, Francine. Thank you to our guests, to all of our business partners. We are excited about this deodorant. We are excited about our Freedom Conference, but more importantly, we are excited that we have a medical advisory board that brings us knowledge and information that we can use to help others. So with that being said, they will take, not me, the two will take questions. You can put the questions right there in the chat box. And if there are no questions, we will see you next time. If there's any questions, you can put it right there in the chat.
Hey, I'm just going to make a quick comment. And the comment is Dr. Bettye was talking about the phase 3 of the program, the cleanse, the body reset. And what I've noticed about that after doing it twice, I don't have underarm body odor. You talking about when you're lifting your arm and knocking people out? So I'm assuming it's from the cleanse, that just cleansing the body has allowed that to be the case where I'm not smelling myself when I wake up in the morning or any of that kind of stuff, or when I sweat, I'm not smelling it. So yeah, just wanted to throw that out there. But so getting rid of all of those toxins works.
Exactly, it sure does. I see a question in the chat, and it is about our extreme pain relief, and they wanted to know if it goes into the bloodstream. So topicals do not cross the blood-brain barrier. So they will nourish the tissues around the area that you put in, but it doesn't go into the bloodstream per se. So for instance, our power has the legal limit of THC, which is 0.3%. And even if you have a drug screen and are using that topically, you will not show up as positive. So there's some proof for you that it doesn't cross. Dr. Rita?
Perfect. That's it. Thank you so much.
Okay.
Somebody did ask a question. I'm not really sure about the question, but how do I relate this information to 101 CBD? That was Elton.
Okay, so CBD is, thanks for asking that question. In my haste, I did not say anything about it, did I? But in my haste, I've neglected to let you know that the CBD actually boosts your immune system. It actually has it protects against microorganisms, so bacteria, bacterial infections, bacteria being exuded from or developing in the areas, especially where perspiration might come out, is lessened tremendously. In addition to that, CBD actually has protective qualities for the skin, and it also has inhibits the growth and development of bacteria and other microorganisms. So we were talking about our new deodorant that's coming out. Of course, it has CBD in it. And so that is going to, along with the other ingredients and essential oils, is not only going to minimize inflammation, it's also going to minimize and or eliminate, I want to say eliminate, the development and growth of bacteria, which is what causes the stinky pits.
I'd also like to add, can you hear me?
Yes.
And that CBD also it inhibits growth of cancer cells.
True.
So when we're talking about breast cancer, and then also inflammation, you know, since we were talking about inflammatory breast.
And believe it or not, inflammation has been proven to be pretty much the foundation or the underpinnings of all diseases and conditions, cancer being one of them. When the cells get to dividing uncontrollably, this is because of toxins, sometimes even parasites. And so as the CBD brings about balance in the body, it helps to, of course, minimize that abnormal cell division. And now I'm talking, of course, taking it internally, because it is doesn't, like Fran said, does inhibit abnormal cell growth, which is, again, is about tumors, and it is has been proven to assist in the warding off, I guess you could say, of cancer.
In addition, also I'd like to add that because there's so much anxiety associated with breast cancer diagnosis and even testing, CBD helps reduce anxiety as well.
Okay, do we have anything else? Okay, right. CL Bell said, thanks so much for this information and the diagrams. Let's do it once a month or every other month, because this really is a lot of information. And there are just so many things that we can do to minimize the effects of our environment on our bodies. But it's about being aware, it's about being educated, it's about knowing that these things exist, so that you're empowered to make a change, or even to understand what changes you can make that would be beneficial to you. So thanks for that, CL.
And also, I like to, Betty, before you go on, that remember the squeaky wheel gets the oil, in terms of getting information about your health. If you ask and you don't get the answers that you want, you keep asking. We have to, again, advocate for ourselves and teach our families to be self-advocates.
Yeah. All righty then. So I don't see any other questions in the chat. So again, we want to thank you guys so much for your patience and your attendance and your participation.
Fantastic, ladies. Thank you so much again. I love this forum, and it appears that those who have attended also love this forum. So it looks like they're requesting at least once a month. engaging. These kind of conversations are very, very important. And thank you for tying in the CBD as it relates to breast cancer, reducing cancer cell growth, reducing anxiety, reducing inflammation. All of that is very, very important as we talk about utilizing our products to prevent and even to assist with symptoms that are caused by breast cancer. We can't make claims that our CBD products are going to cure breast cancer, but they absolutely can help to assist with some of these symptoms. So if you're a guest on the line, please connect with the person that invited you. Super important, so you can get products ordered. You can find out more about our company and how you can lock arms with us here at Wakana. Again, thank you, Francine. Thank you, Dr. Bettye. And of course, thank you, Dr. Erica. Thank you, Erica Zachary, for always being here and supporting this call. Thank you, business partners. We appreciate you joining, being patient tonight. And thank you to our guests. Be well, be safe, and good night.
Good night, everybody.
Good night.
Bye-bye. Good night. Bye-bye.
Bye.
Bye.
I don't know how to leave.